How does that feel?
Feels good. It's nice and soothing, and it's also relaxing, especially after a hard day.
You can do this at home if you'd like. This is very easy to do. And just put your hands on someone's back or neck. And just stroke like this. Here we go.
That
and it
sort
has
of
a nice
motion.
feel to it,
Oh,
right?
yes, that sort of motion, yes.
Yeah, that motion just feels wonderful. Okay, here we go. And I'm going to start aligning the vertebrae in the back. After an accident, you could imagine that the various joints in the body have been disrupted, have been ripped and torn, and are swollen and inflamed. And I'm going to ask her certain questions, and we'll start from the bottom and work up, because most of us suffer with chronic lower back pain. Is this or this tender when I touch here or here?
Yeah, they're both pretty tender.
Both tender. Let's clean that up and get these joints working properly. I'm using a handheld impulse instrument, which is FDA registered and has a lot of research behind it that shows that it moves the various vertebrae. How's this in here?
This is sore, but I always feel better when I leave it. It's quite sore right now.
And scientists and doctors wanted to know if it moved the bones, and whether it moved the bones enough to allow people to heal. And the research shows that it moves the bones and helps realign, restructure, and rehabilitate the spine and nerve system. I'm going to examine her hips today. I'm going to wiggle her legs in and out because it all works together, and her hip is not moving well. I'm going to use the instrument over the piriformis muscle on the left hip. I'm feeling with my hands to determine if she has muscle spasms. And you can see she's wearing a knee brace here. And in just a minute, after I work on her hips, I'm going to work on her knees too. And you get to see how we know if we line the knee up, how we know if someone has a knee problem, and what we can do about it. Her feet are fairly even from left to right, and you can see I'm doing a leg length analysis, and she's fairly balanced, but I'm going to push on her knee and push up on the cartilage of the knee, and you can see that right leg shortening by almost an inch. It's quite remarkable, really. And I'm going to adjust her talus or her foot bone and adjust where the medial meniscus is in the knee, and you can see that makes the knees more even. And I'm going to push again with my hand, and you can see that she's nice and even, that's a good adjustment. It's a quality adjustment. And I'm going to pull on her knee a little bit, and if I pull her knee back, her leg shortens again, which indicates that her tibia or her lower leg is pushed back, and I'm setting it in proper alignment. And I'll pull again and we'll check, and her knee looks more even, more balanced. And it was primarily your right knee. Is that true?
Yeah, my right knee.
Here we go. Very good. So that's more even. How does that feel?
That feels great.
The audience is wondering how that feels. I'm
Yes,
also going to examine her lower spine, her lumbar spine. And adjustments to this part of the spine help the knee. This is the fourth lumbar vertebra. And adjustments here help the knees, helps the organs of elimination, helps the pelvis, helps the hips, helps us walk. Head in the center. And bring your head in the middle. Thanks so much. Here we go. And let's check her neck. And I'm going to press on her neck. And her neck is restricted or limited when I push it. It should be more resilient. It should be more flexible. We'll get more movement in her neck. And I'm going to pull her neck back and gently realign, rehabilitate, and restructure her neck. I'm going to check the mobility left and right in her neck. That's good. Okay. Not bad. I'm feeling her neck to make sure that it bounces back, and that it moves properly. And I'm checking lateral flexion, and I'm checking rotation, because after an accident, the muscles and the ligaments and tendons that hold the neck together are ripped and torn, and I'm working with my hands and fingers, and we're giving her a nice massage. Turns this feel that they're wondering.
Well, you know, my shoulder I've been having some problems with that left shoulder. And the accident kind of made it a little worse, but so since I've been coming here, you know, that little tear I had over there, I mean, it just feels marvelous. It feels so good. And you told me I might not need to have surgery because the chiropractor is working. So I'm glad to hear that as well. If it can prevent me from having surgery, I'm all for it.
Very good. Here we go. She has some inflammation in this part of her spine, and I'm going to use a special attachment and gently realign the vertebrae. And it reduces pressure on the nervous system. It helps the immune system function. It diminishes stress. It prevents arthritic change. Makes us more flexible. Stops spinal decay. I'm going to work on the little muscles of the left and the right shoulder. Here we go. Right in here, right in here, right in here. And this is where we hold a lot of stress and tension. And I'm going to do a special adjustment for her shoulder. And you'll want to see this. I'll lift you up. Here we go. And you feel yourself move up. And I wanted the audience to see, because shoulder problems are difficult to address. Lift your arm before we get started. Get it to a point where it starts to hurt. Where does it hurt?
Probably about here.
About
Remember
there.
when I came, it was here though, so it's getting better, but it's a little sore.
You're
Yeah.
doing some better,
Yeah.
but it's not a full,
It's not all the way. Yeah.
what they call abduction, or ability to lift the shoulder up. You should be able to show them what the right one looks like, because that's the normal side.
Yeah.
And that one goes almost straight up. Can you bring it straight up?
I can.
Fantastic. And bring it back down when you can. And let's go ahead and we're going to adjust the small joints where the clavicle attaches to the sternum. We're going to adjust the bicipital tendon. We're going to put the acromioclavicular joint back together. We're going to adjust the muscular insertion of the scalenus anticus, the beta scapula. We're going to work a little bit on the trapezius, the subdeltoid bursa, the insertion of the left deltoideus. And I wanted you to show them the difference. How far can you lift it now?
Oh,
That looks
wow.
pretty. Look at that.
Yeah.
Isn't that cool?
Yeah.